to us about this divergence in containment policy between the East and the West. We've seen how, the likes of Singapore, despite small cases relative to the West, they're clamping down, closing borders, but the U.S. and Europe opening up.
Yes, there certainly are different approaches to managing COVID-19, but I think we need to keep in mind that each of these countries, each of these regions, territories, states, all actually are handling it in very different ways. Even the United States cannot be considered a whole, homogeneous approach. The key here is that we have to increase vaccination rates, and Singapore now is really pushing hard on that. With these kinds of changes, we continue to do contact tracing, testing, wearing masks, social distancing. The approaches will all converge to the same point, which is we will get this pandemic under control.
But is the approach correct? Is zero tolerance for new virus cases the right way to go about?
The truth is, I don't think any government is really thinking zero tolerance. What they're thinking is risk mitigation. How low do we need to go in order to ensure that our healthcare system can continue to take care of patients in the way they need to be cared for? Now, with vaccination rates going up, we know that folks will be less likely to get infected, will be less likely to get very sick and die. And therefore, the risk tolerance, the risk budget should be able to be loosened up a bit. But we're not there with vaccination. So folks, get your vaccines.
Tell us here as well, with your members, what are their major fears right now, and what are they talking about the state of their corporations? How's all this been impacting?
Well, I think when it comes to the business status, when you're talking about stability, when you're talking about growth, some businesses are actually doing pretty great. We know that healthcare and tech, they are very, very stable and they are growing in need of more labor. But on the other hand, we know that travel and leisure is suffering. It's not just about business growth, though, or business stability. It's really about the people, the emotional state of folks. When you start to hear about various lockdowns, when you start to hear about increased restrictions, that's what we've got to tackle. We've got to reassure people that this is going to be temporary. We are learning ways to avoid a total lockdown or circuit breaker, as we call it here in Singapore. We ring fence, we test, we ask people to get vaccinated. Then that way, mentally, we can cope better with these restrictions as they come and go.
Well, Hsien, give us a sense of also, the best approaches that you've been seeing, the best practices employed by corporations there in Singapore, in your view.
Many of the companies have been doing a wonderful job looking after their employees, creating environments in the home so that it makes it easier for them to work from home, providing social support. As an example, I am part of a group called Work Well Leaders. MNC CEOs, multinational company CEOs, and small and medium-sized enterprise founders and business owners come together and we say to each other, how do we care for one another? How do we care for our employees? Because it has an impact on the bottom line. So you see people providing various mental well-being apps, being able to come together in small groups on Zoom, and soon hopefully in person. Those are all going to be vital in moving us forward in this particular environment where we know that infectious disease is present.
But having said that, there's still increasing pandemic fatigue. And in the case of Indonesia, for example, it's seeing 7 variants of the virus. I mean, how much more complicated is it for us to get to the other side, Sean?
It is complicated. I mean, viruses mutate. We know that. When I was a virology student, boy, you can't actually count the number of mutations, but also keep in mind that not all mutations lead to a more infectious virus. It is part of evolution. So we are going to learn as scientists. The knowledge will continue to evolve. So I want people to understand science evolves and gets better, and we will learn how to manage this virus. If you look at the influenza virus that kills hundreds of people every year, just in Singapore alone, we know that flu viruses mutate, and we've kept up with it. And we've asked people to get vaccinated year on year. We will also get to this point with COVID-19. Remember, this virus has only been with us for about a year. We're still learning a lot about it, but wow, we already have a vaccine.
You know, Hsien, vaccinations prevent us from getting a severe case of COVID-19, but it also means that some of the symptoms are now a bit more muted. For instance, you may get a cold, and which is quite similar to the cold that you get from the flu. I mean, that makes it even more difficult to identify if you're infected with it. Yes?
This is the challenge. Another thing I've been reminding folks is COVID-19 is not the only virus around. Folks are still getting sick with a whole lot of other things. So it's really important to take care of yourself. In Singapore, we have dengue fever. In other countries, there's malaria. Flu still floats around, although at a decreased rate, given the fact that we are all being more careful with hygiene. But it just goes to show you that when at this present time, if you have a respiratory symptom, you just got to go check it out. Previously, you might have been asked to stay home and get a little sleep. Not now, not now. But when we get vaccination rates up, things will change. But do the duty, go in and see your doctor. It's just a small thing to go get checked out.
Yeah, but one of the stark things out there is the whole difference between what's going on in, let's say, Europe, the UK, and America compared to what's going on here. Is there a chance, in your view, that we get over this sooner than later now? Because it does seem as though there's been a bit of a slowdown in this part of the world.
Yeah, I hate to sound like a broken record, but definitely vaccine is not necessarily going to solve all our problems, but it is a big component of it. So the more that we can get higher vaccination rates, the better improvement we'll see in terms of how we're able to conduct our daily lives, how we actually do business. If you look at the US and Europe, their approach has been, US in particular, has been getting those vaccination rates up because the mask wearing and all of that have somewhat gone away. We're not at that phase here in Asia, but it's all for the better because that means that we can resolve the situation a bit faster because we're taking multiple countermeasures.